Welcome everybody, how are you today? You good? I'm here on behalf of the Woolworths Baby and Toddler Club, so for anybody that hasn't yet joined, I urge you to join. There's a plethora of information on the site, from recipes to nutrition tips. We've got a lot of experts on there that are telling you some absolutely fantastic information, so please get along and join the Woolworths Baby and Toddler Club. Today I'm going to be talking about how to get your mojo back post-baby. So I think it's a really important topic. Who here has a baby already? Great. I've got a little baby. That's Sophia down the back there. She is, oh, she's still awake. She is nearly 6 months old. So I've had to go through the process of getting my mojo back post-baby as well. Today I've been given 20 minutes to talk, so I've got so much information to tell you. What I will say before I start is that on my website, which is just emmasutherland.com.au, there's a little red button there that's got all the notes from today's talk. So don't worry about having to try to remember anything. Just go to my website and then there's a PDF there of the notes, okay? So just sit back, listen and absorb. First of all, I'm going to talk to you about the blue zones. The blue zones are magical areas around the world where people reach the age 100 at 10 times greater rate than average. So these are areas around the world where people live really long lives and they live with a lot of vitality. You might have heard of Sardinia in Italy, Okinawa in Japan. These are the magical blue zones. They were discovered by Dan Bretner and National Geographic. And they found that these people had various characteristics in common. The first one that they discovered was that these people knew why they woke up in the morning. Now, not just because the baby was crying, I mean the big picture. What is your purpose in life? Why are you waking up in the morning? What's your passion? What's your mission? What is your goal in life? People that have these goals and these missions very clear live 7 years longer than people that don't. So I urge you to start thinking about your big passions in life because they add a lot to your vitality. The next thing they've discovered about these people that live long and healthy, vibrant lives is what they called the 80% rule. They suggested that reducing 20% of your calories with evidence-based practices like eating breakfast, which we all know we should, eating with your family, turning the TV off when you eat, and also practice mindful eating, which can be as simple as taking 5 deep belly breaths before eating each meal. This will activate your digestion and you'll absorb more nutrients from your food. So the 80% rule simply implies that we're eating too many calories and we've just got to cut them back just that little bit to prolong a long, vital life. The last one, I have to say I did laugh when I did this research, is called wine at 5. And the research says that people that drink outlive people that don't drink. So this was a hallelujah moment for me. Wine at 5, ladies and gentlemen. But what it shows is that it takes 1 glass of wine per day. We're talking about 150 ml of wine. We're not talking about a big fish bowl that we tend to pour these days. 150 ml of wine per day, particularly when consumed with a plant-based meal, will add to your longevity and boost your vitality. So the magical blue zones, we've got a lot to learn from these people that live long and healthy lives. So we do know, cut 20% of your calories, know your purpose in life, and have a small glass of wine every day will really boost your vitality. So how simple is that to do every day? Pretty simple, huh? So that's your first step in creating a little bit of mojo back in your life. Now, I've spent about 10 years working with women in the area of optimizing their health. Anything from fertility to weight loss to getting their mojo back is what I do. And over the years, I've discovered that there's common mistakes that women make that are draining their mojo. When I filmed the TV show Eat Yourself Sexy, I put these theories of mine into test and tested them with the TV show. So, you know, I had a lot on the line here. What I'm going to share with you now is my top 3 impediments to maximum mojo. So listen carefully, because these are mistakes, as I said, that women are making every single day that's draining their mojo. The first thing I want to talk to you about is vitamin D. Now, vitamin D is that sunshine vitamin. To give you a bit of context on vitamin D, a research that came out 2 years ago from Victoria showed that pregnant women, about 65% of them are low in vitamin D. If you're pregnant and have low vitamin D, you have 4 times the rate of C-section than women that have good levels of vitamin D. So what I'm saying to you is that vitamin D is not just the sunshine vitamin. Did you know that having low vitamin D will increase abdominal weight? It puts you at an increased risk for not only osteoporosis, but also immune problems and depression. So vitamin D is really, really important for us women these days, and us men. Now, researchers from the University of Minnesota, they discovered that people that were trying to lose weight, struggling to lose weight, or people that had dropped weight and then plateaued, if they added vitamin D3 to a protein-rich diet, this switched on their fat burning. It switched on their metabolism. So vitamin D has so many important functions within our lives now, not just during pregnancy, not just during, as a child. We think of vitamin D for growing strong bones. It's not just about that anymore. There is a lot of research that I wanted to share with you today on the importance of vitamin D. So what are you going to do about this? It's easy. You go and you speak to your healthcare provider, whether that's your naturopath or your GP, whoever it might be. You ask them to do a very simple blood test, check your vitamin D levels. Now, if it's low, you need to supplement, because unfortunately a lot of people don't convert vitamin D from the sunshine very well, and we're about to enter winter where our vitamin D is just going to drop anyway. So check your vitamin D. You need to supplement. The research is saying for at least 3 months. Now, this is not something that you just, take some vitamin D for a couple of weeks and bang, it's fixed. You need to work at it for about 3 months. And then in 3 months' time, retest your vitamin D. So my first tip for Maximum Mojo is absolutely making sure that you have really optimal levels of vitamin D. The next one I want to share with you is sleep. Now, who here has at least 1 5-hour block of sleep every single night? Does anyone get a 5-hour block? One lady, one lucky lady. Sometimes, yeah. I can honestly say that I very, very rarely get a 5-hour block of sleep. Little Sophia wakes up nearly every 4 hours to feed, so I kind of never get a 5-hour block of sleep. So what's important to realize about sleep? It not only makes you feel good, it's not only when your body heals and repairs, but it's about the quality of your sleep. So researchers from Stanford University found that people that sleep 5 hours or less per night had a disruption to their hormones. So sleep affects your hormones. If you sleep 5 hours or less, you will have 15% more ghrelin. Ghrelin is the hormone that increases your hunger. And you also have 15% less leptin. Leptin reduces hunger. So what this says is that if you're not getting 5 hours sleep per night in a block, 15% of the time you don't realize you're full, you overeat, and you crave foods that are going to be a quick energy fix. Now, this is because it disturbs your hormones, not because you're emotionally tired. When I first looked at this research, I thought, of course, when I'm tired, I crave banana bread and a cup of tea to pick me up. But it actually causes a sleep disruption to your hormones. Interesting, though, is that researchers said that even less than 8 hours sleep per night causes an imbalance in those two hormones. So over time, you become, if you have continual less sleep than you need, you become what's called leptin resistant, and that shuts off your body's ability to use fat for fuel. So you end up putting on weight. And 15% of the time, your brain doesn't get the message that you're actually full. So proper sleep is fundamentally important for Maximum Mojo. What I must say is that it's sleep quality. It's sleep amount, but it is also sleep quality. So I don't get much sleep, but my sleep quality is really good. So it makes up for it. So what can you do to optimize sleep quality? Okay, first of all, look at some herbs or some homeopathics that can optimize your sleep quality. I can't do anything about the fact that Sophia will wake up and feed, but I can do something about having better sleep quality. Why not have an Epsom salt bath? If you have a bath, a big cup full of Epsom salts in your bath, a couple of drops of lavender essential oil, and that will completely relax all your muscles. If you don't have a bath, put a couple of drops of lavender essential oil in the corners of the shower. It'll vaporize and really soothe your sympathetic nervous system, okay? So there's ways around everything. The other quick tip for optimizing sleep quality is chamomile tea. It's something so easy, but the way it works is you've got to do it properly. Two tea bags, 100 ml of boiling water, cover the cup, because all the active ingredients are in the essential oils. If you don't cover it, they're just going to dissipate out. Cover it, strain it, 100 ml, have that half an hour before bed. So Epsom salt bath, use some herbs to help your sleep, lavender in the corner of the showers, and also your chamomile tea, and it will go a long way to optimizing sleep quality, okay? So far we've got vitamin D, and we've also got sleep quality. There's two things you can do straight away that will optimize your mojo. Don't forget, in the blue zones, they have long, vital lives. That's what we're aiming for. My third tip is actually, I'm going to talk about your thyroid gland. Now, your thyroid gland sits here, and it rules your basal metabolic rate. Now, with the thyroid gland, it's interesting, but about 17% of women have what's called subclinical hypothyroidism. Has anyone heard of this before? A couple of people. What this term means is that when you have your thyroid checked by by whoever, they check your TSH, the hormone TSH. Now this looks perfectly fine, but when you check the thyroid hormones themselves, the T3 and T4, they are out of balance. So what happens if your thyroid is sluggish? Well, this happens post-pregnancy a lot, where you see women, their hair's dropping, their nails are dry and brittle, their skin is dry, struggle to lose that last 5 kilos of their baby weight. This is the kind of situation where I'll always say to women, we need to check your thyroid and we need to do a comprehensive assessment of your thyroid. What do we need to have your thyroid really, really beautifully functioning? Well, there's a few things that we need. Nutritionally, we need a lot of iodine. Has anyone had their iodine levels tested? No? Okay, about 74% of Australians are low in iodine. It's a trace mineral. It's really important for the growth and the spinal cord development of the baby. So you'll notice in all your prenatal supplements you have iodine these days. That's why. But you should also have it tested, because not only is it important for the baby, the thyroid needs iodine to actually build your thyroid hormones. So if you don't have enough iodine, which 75% of the population approximately do, then your thyroid is going to struggle to make enough hormones in the first place. So your thyroid, don't forget, rules your basal metabolic rate, and in that first trimester of pregnancy, it supports your progesterone levels, the hormone that optimizes pregnancy. So we need a lot of iodine. We also need a lot of zinc. A lot of people are low in zinc. If anyone has a look at their nails and you see little white spots on your nails and you see tiny pin-sized little divots, then you're more than likely to be low in zinc. Your thyroid needs a lot of zinc to actually convert the thyroid hormones into their active form. So why not start looking at optimizing the foods that are higher in zinc, like your nuts and your seeds. Tahini is a wonderful source of zinc. Now we also need a lot of selenium, which is a trace mineral, which a lot of people are low in. We need tyrosine, the amino acid, which is only going to be found in proteins. So you need good proteins in your diet, and you also need a lot of B vitamins. So it's very important to have all of these nutrients in abundance if you want your thyroid to be functioning as well as what it should be. Now ladies, who would say that they feel stressed quite a lot of the time? Hello? Yes, we're busy, we're mums, we're doing so many things at once. With stress comes the hormone cortisol. It floods your body with the hormone adrenaline as well. Now cortisol, unfortunately, it has a tendency to block the way that your thyroid works. So if your cortisol levels are always high, then it will suppress your thyroid hormones. So having really good stress management techniques are important, having good support network around you wherever possible, making sure that you're prioritizing yourself. How many of you have thought, when I'm in a fractious mood, when I'm tired and when I'm grumpy, my baby feeds off that, and my baby is having a bad day as well. I've noticed it with Sophia. When I have a bad day, she's having a bad day. So looking after yourself is the number one thing you can do to look after your children and look after the rest of the family. As they say, happy mum equals happy family, right? Because we tend to be the centerpiece of a family in many ways. So what I want you to do is think about getting your vitamin D levels checked. Think about getting better sleep quality, and also look at potentially having a comprehensive assessment of your thyroid, because unless you have all three working as well as possible, you are going to feel tired. Now, this is a woman that comes in to see me, and when I look at my patient intake form, the number one reason that people come to see me is they feel tired, they lack energy, they get sick often, all of those symptoms that many of us women feel. And I say to you, the reason is because their mojo is lacking. So let's go back a bit, and how would you define mojo? What does that word mean to you? Energy? Vitality, yeah. To me, it's that inner confidence that when somebody kind of just walks in the door and they've got that inner confidence, and you know, they don't look like a magazine. It's not that. It's something that comes from within. It's an energy, it's a vitality that just shines from within them. So if you really want that mojo back, and I passionately believe that every woman deserves to have a life filled with mojo, if you passionately want that, then you're going to have to put a little bit of work into it. So vitamin D, increasing your sleep quality, not quantity, because that's not always easily done for us busy mums, and also optimizing your thyroid health. They're my 3 top tips. So as I said, go to my website, you'll get all that information, you can download it. Now, just the last point I want to share with you is some foods and nutrients that will maximize your mojo. My number one is probiotics. Probiotics are the good bacteria that reside in our digestive system. Now, these are very sensitive. If you take the pill, if you take antibiotics, if you drink coffee, if you drink a lot of alcohol, if you don't have enough dietary fiber, the balance between the good and the bad bacteria will be completely out. So you'll feel bloated, you'll have sluggish bowels or loose bowels, eczema, urinary tract infections. All of those symptoms are indicative of an imbalance in your good probiotics. So taking probiotics every day, I think, is a must. Apart from that, you can find, apart from that, she agrees, thank you. You can find probiotics in fermented foods like yogurt and miso. Also, you'll find it in kimchi. Has anyone heard of kimchi? Yeah. It's like a pickled, it's like sauerkraut in a way. So all of those foods are high in probiotics, so they're a good idea to have. The next tip I want to tell you about food is to stay away from low fat. A lot of people look at me strangely when I say that. Low fat means there is no fat, right? Now, your fat-soluble nutrients, vitamin A, vitamin D, vitamin E and vitamin K, are all found in the fat. So if you strip out the fat, you're not getting any of those nutrients. And we've already spoken about how important vitamin D is. So low fat is not a mojo-making food, okay? The other thing about low-fat foods is there's 3 things that generally make food taste good. We've got fat, sugar and salt. So if there's no fat in there, more than likely it's going to be high in sugar or high in salt. So start looking at your nutrition panels and become what I call a food detective, and start looking at the labels. Stay away from low-fat products if you're after maximum mojo. What I suggest is that you have a small amount of full-fat products each week. You don't need a lot, but you do need some. We need those healthy fats. The other thing I want you to think about with low-fat products, fats are the building blocks for your hormones. The number one correlation I see in low libido with women is that they're eating no-fat foods. You need the building blocks to have a healthy libido. You need lots of healthy fats. So that's really important. So please stay away from low-fat products. Did anyone have a question on the low-fat? Because people do get confused, or is that pretty clear? All good? Okay. So just think, low fat is low fun. Yes. Mainly dairy products, but now because it's such a marketing, you know, if something's low fat, people tend to buy it. You'll start seeing low fat on more than just dairy now in a lot of products. But yeah, dairy is probably our prime example. Yeah. Now the last food that I want to talk to you about for Maximum Mojo are your antioxidants and superfoods. Now antioxidants are our weapon against aging. So women, if you want to look good as well as feel good, you want to have a diet that is packed with antioxidants. So these are found in foods like blueberries, pumpkins, sweet potatoes, carrots. They don't have to be fancy foods, right? They are everyday foods. It's about consuming them on a regular basis. So having lots of fresh vegetables and fresh fruits in your diet will provide a lot of antioxidants. One of my favorites are the green leafy vegetables because they're so high in magnesium. Now just a little tip for you ladies, magnesium is a muscle relaxant, so it relaxes fine lines. So if you want to look good, hit the magnesium containing foods, okay? Whenever I'm starting to feel a bit stressed and run down, I always increase my magnesium foods. I'll have a green veggie stir fry, that kind of thing. Now superfoods on the other hand are the more exotic ingredients, and these are things like spirulina, acai powder, chlorella, raw cacao. Has anyone started experimenting with raw cacao at all? No? Yeah. It's very high in magnesium, and you can make raw cacao into little protein balls with just a mix of nuts and seeds, and they're really, really good for you. There's a recipe on my website for superfood brownies and protein balls that have the raw cacao in them. So no low-fat foods. Lots of antioxidants. Have a superfood most days of the week if you can, and change it up. You know, when you run out of one, buy something different. Don't stick to the same thing. Get lots of variety in your diet. And also, for your Maximum Mojo, remember the 3 top tips that I have for you. Check your vitamin D. We're about to hit winter, so your vitamin D is only going to drop from this point forward. Make sure your thyroid is working as well as possible, and make sure that your sleep quality is optimized. Now I hope I've given you tips with each of those things that you can actually walk away and start doing. So things like your Epsom salt baths, your chamomile tea, all those kind of things. So have we got any questions about anything that I've spoken to you today? Because I do believe that you all need to have Maximum Mojo. Who feels like they've already got it and I'm preaching to somebody that already has Maximum Mojo? No, I don't have Maximum Mojo. I aim for it. I really aim for it, right? Kim? From a health food shop? Yep, health food shop, you'll get your raw cacao. Now this is not cacao, you know, it's raw. It needs to be raw, so it's unprocessed, so it contains all of those superfoods and nutrients. Yeah, yeah. So good thing to add into recipes. If anyone has any further questions, let me know. Yes? Okay, this was a really interesting question. The question was, what dose do you recommend for vitamin D supplementation? First of all, don't self-prescribe, go and get it checked. Secondly, a study that just came out in the Journal of Osteoporosis last month showed that people need up to 5,000 international units a day over 3 months to get their levels above low. So it tends to be something that builds slowly in the body. So check it, supplement with vitamin D3, and then retest 3 months later. And it's really imperative that you do retest because a lot of people don't absorb vitamin D very well. So you might need to look at, why you're not absorbing it well.